All right. We are going to call to order starting with the public hearing on the town of East Long Meadow regulation restricting the sale of tobacco products for the Board of Health. Today's Tuesday, May 16th, 2023. The Board of Health is recording. Is anyone else recording? Okay, and we are meeting tonight via Zoom webinar pursuant to former Governor Baker's executive order suspending certain provisions of the open meeting law effective March of 2020, which was recently extended by Governor Healy in March of 2023. So the item on our agenda for this evening is the presentation of the proposed Town of East Long Meadow regulation restricting the sale of tobacco products. So Sarah, thank you so much for joining us tonight. So Tammy and Sarah, I'll turn it over to you.
Do you want me to just go through the summary that we have? Would that be good? And I'm going to read it out, even though it's from paper. This is the summary that we put together for our businesses in town. So I'll just read it out then. One would be the addition of the rolling paper definition, permitting the ban of flavored non-tobacco, non-nicotine wraps. Two, the maximum number of tobacco product sales permits will decrease from 18 permits to 14 permits, the current number of permitted tobacco retail establishments in East Long Meadow. If a permit is surrendered, revoked, or not renewed, the permit shall be permanently retired by the Board of Health, and the total allowable number of tobacco product sales permits shall be reduced by the number of retired permits. Three, single cigar minimum pricing to increase from $2.50 to $2.90. Four, cigar multi-pack minimum pricing to increase from $5 to $5.80. Five, tolling periods for violations to increase from 24 months to 36 months for local violations. Six is about suspension periods. That was for state law fines. The first violation would be for 3 consecutive business days, second violation, 7 consecutive business days, and third violation, 30 consecutive business days. Okay. Something.
I think the only thing that I would add is that your draft regulations bring the town of East Long Meadow's regulations up to the state level, and in some policies you exceed the state law, like the cigar packaging, capping the number of permits, things like that. But all the new things that Governor Baker signed into law in December of 2019, you now have language that brings you up to that.
All right. Thank you, Sarah. Thank you, Tammy. Is there anyone here for public comment on the proposal?
There's no one.
Okay. Katie, Rebecca, any questions, any discussion items, anything you've noticed in the regulations that you want to bring forth?
Not that we hadn't discussed before, no.
No, it looks pretty clear cut.
Okay. The only thing I noticed is that on I put a sticky in it. Page 8 on number 4, it still says city town. It probably just needs to be updated to read town of East Long Meadow.
Fix that. And then I'm also noticing that along with taking the draft watermark out, which I can do, I started with page 0 for some reason. So I'll change the pagination to page 1. Where did you see that, the city and town on page 8?
Page 8 under number 4, a separate permit displayed conspicuously. It's required for each retail establishment selling tobacco products. The fee, as defined herein, the fee shall be determined by the city/town Board of Health annually.
Got it. You got it.
Is my page 8 not the same as?
That's my page 7.
Oh, okay.
But it would be page 8 once I repaginate.
Yeah, mine starts on page 1. So, and there's a couple of random places where there looks like there's highlighting spots that didn't color
Are you looking
highlighting.
at the older one that we sent you, maybe? Not the
You
one. from
might be.
today?
I thought I read the one that you sent like today or last night. Hmm,
Didn't see any highlighting that's stuck.
okay, maybe I printed an older one. But that's
But-
the only thing that I noticed.
Yeah, it'll be easier for me to see it once I take the watermark off. And if there is anything, I'll remove it.
Okay. Any other items or points of discussion? Rebecca or
Oh.
Katie?
You folks do need to decide when you'd want it to take effect.
And the state is already doing this already across the board?
The state is doing everything that you weren't already doing before.
Okay.
And has mandated that local boards of health do it. So you've been doing it, in fact,
Okay.
even though it wasn't in your local regulations.
So for instance, if we say it comes into effect June 1st, because then that way it gives people to make changes, that would be enough?
So
would be-
all, yeah, also what Tammy was reading was sent to all of the tobacco establishments. So their actual store and their, if they had a, if they're you know, like a gas, like a Cumberland Farms, it was sent to their office as well, their permitting office. So they've all been notified that, you know, this is happening today, this hearing, and that those are the changes coming down the line. So if you want to make it effective tomorrow, you know, I can go out and make sure that each establishment knows that this happened.
And do you have to do that, Alex? Do you have to confirm with every establishment in the town?
I mean, it's something that I would want to do, obviously, just make
Okay.
sure that they have the new regulation, that they got the letter, you know, even though, like I said, it was sent out to everybody. And that they're in line before, you know, say like the TCOs go out and do their inspection, and so that they're not fined for something that they might not necessarily not have known about.
Well, if we're able to do that, then I would motion that we do it effective May 17th.
The only thing that I think would immediately affect your retailers is the raise in price on the cigar. But that shouldn't be an issue. They keep that extra money. So if that, you know, if they pay 29 cents for a cheap thin cigar and now they have to charge $2.90 for it, they keep that extra money. So
So
It
does
would
it make
just
more
be a-
sense to give them like through the weekend then in your experience? So like having it come into effect
Well,
on a Monday?
it would just be a matter of them, you know, letting their employees know. I mean, certainly, I would doubt that you're going to plan to go out and enforce heavily on this the day after it goes into effect. So, you know, once they maybe get a copy of the new regulations and everything, that then they'll you know, let their staff know that there've been any changes that would affect them.
Tammy, Alex, is there a time frame that works best for the health department? Because you're the ones who like go out and do the actual work, or you're the ones who have done the communication with the businesses.
I like that nice and neat of the first of the month. That way we can drop the letters, get the letters out. We can do some visits.
Plus, I think it gives you just more time. You're not under the gun rushing around. Start off a new, fresh month.
You like that, Alex?
Yeah, that's fine with me.
Do we have to motion to addend the paper thingy charter, whatever it's called? Because it's a formal document we have to vote on. I'm trying to remember Robert's rules.
I think if you're gonna vote to accept it, accept with those changes.
With an addendum, okay.
Mhm.
So
Yeah,
then
we
I
can-
motion to accept the tobacco, is it charter?
It's the
Regulations.
Regulations.
Tobacco regulations with the addendum that this will go into effect June 1st, 2023.
Okay, I second that.
Should we be saying with the requested changes?
Mhm.
With the requested changes.
Yes, with the requested changes applied.
Okay, so the motion is on the table and seconded to accept the proposed Town of East Long Meadow regulation restricting the sale of tobacco products with the changes as discussed, effective June 1, 2023. So we will do a roll call vote. Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right, thank you, ladies. So at this point, we need a motion to close the public hearing and open the public meeting. So I can make the motion to close the public hearing on the tobacco regulations and move into our public meeting.
I second the motion.
All right, roll call vote. Christine Johnston, aye. Dr. Katie Jobbins.
Aye.
And Rebecca Torsha.
Aye.
All right, so at this point, we are moving into the public meeting for Tuesday, May 16th for the East Long Meadow Board of Health. And thank you, Sarah.
Thank you.
Bye.
Sarah.
Right, so we do have minutes from the last meeting. These are from the meeting from March 23rd, 2023. Does anyone have any changes or additions to those minutes? No, looks good. And always, as always, thank you to Renee for helping take the minutes. So we are going to do a vote. If I can have a motion to accept the minutes from March 23rd meeting as written.
I motion.
I second.
All right, in a roll call vote, Christine Johnston, aye. Dr. Katie Jobbins.
Aye.
And Rebecca Torsha.
Aye.
All right, so the minutes from the March 23rd, 2023 meeting are accepted as written. Is there anyone here for public comment on this portion of the meeting?
No indication.
All right, thank you so much. So we're gonna move into business at hand. Tammy.
Business at hand.
Yep. Starting with trash and recycling.
Yes, I'm telling you, it's been very busy when it comes to that. I'll give the update on our recycling program with the schools. For April, which in April there was, mind you, 1 week off of school because of vacation. And mid-month, we started at the high school for the program. We were able to divert 4,829 pounds of waste from the cafeteria. And I'm not sure if I gave this number before, but the amount of waste that's been reduced in the cafeterias, we've reduced it by 95%. It's pretty significant. So right now, Liz kind of just finished up working with the high school. The food service staff is very helpful at the school. They've been really just trying to figure out ways that they can get rid of the reusables and kind of move over to multi-use things like utensils. I know they found some of those, so they're going to try to bring those back into service. They've been using some compostable trays, compostable utensils. So that makes it a lot easier. I think the little kids, they're very good at following rules as you go through, but the older we get, the more we kind of either don't pay attention or we need a little prodding. And so I know that with both schools, there's been, with both the middle school and the high school, there's been a lot more work, but we also start getting more personalities as that showing as we go.
For feedback, a friend of mine's son you can like work with the custodian at Mountain View, which is apparently like a fan favorite there. And he was so excited because he got to be involved with the recycling program within the cafeteria. So he was very excited about it.
I think we have some of that in the video that's up on LCAT too. Some of the students who are doing that there, and they do look so excited to do it. But that makes me happy. And so I think this will be, once we go into once we get all of May, we should be able to see what a full month with all the schools looks like and how much that because there's not really any holidays in May. to take off. So we'll see how that looks. I'll report the next one.
I know that with one at Meadowbrook and one at the high school, they hearing like, why do we have to do this? Like, we've been doing it this way for our whole lives. Like, and the Meadowbrook kids are like, okay, so the food go and like, so hopefully next year will be a little bit easier. Moving in that it will be more normal, and even the students moving from school to school will be like, okay, this is where we go, and less training, because I definitely heard that from the complaining side of the teenagers is like, well, this just seems ridiculous, and the littles were like, great.
They're helping the environment and saving turtles, that's but hopefully that attitude will kind of go on and bring, we'll have adults who are environmentally conscious, which would be really nice. Every little bit helps. Let's see. Also, kind of under the recycling theme, we had in April, we had our Earth Day events. The kickoff event was at the library, and it was a nice opportunity to highlight our sponsors. We had also Commonwealth Sustainabilities, who's doing our organics waste program, were there. They displayed artwork from the high school, and also we had a Earth Day logo contest it was a 5th grade, right? And that was really nice. And they posted the final logo up on Facebook. For the actual day, there was over 200 volunteers participating. And let's see, the amounts that they cleaned up were 1.4 tons of trash, which was 2,820 pounds, and with 25 tires, and 800 pounds of recycling, which was fantastic. And some of the weird, let's see, we found parts of a motorcycle, let's see, a garbage grinder, so we had categories for prizes that from the sponsors that were doing prizes, and one of our newest categories, we believe, is going to be the best non-human trash collector, and that would be Gabe the goat. So that was really fun. If you check up on the Earth Day's the Earth Day's Facebook page and our trash Facebook page, you'll see pictures of Gabe and everybody else who participated. So it was nice. Let's see. As for COVID-19, right now we're seeing almost the same number of people every week going into get tested for COVID. It's around 10 to 11 people, or not every week, that's every 14-day period. The difference is there's not as many people testing, so the percentage rate's been going up. So whereas 2 weeks ago, it was 11 people had getting tested, but it was more like 300 people had tested total. So it was only like 2%, whereas here 195 people tested with 11 positive, so that came out to 6%. We're still seeing the numbers, but we're not seeing really huge cases. Vaccination.
I know even like some of the medical facilities, like my pediatrician's office, they now ask you to home test before you come in for a sick visit. It's saving them a ton of time in the office, because you don't have to wait in your car for 15 minutes. So some of that is probably just reducing the number of even medical facility testing. And then they get, like, when you get there, they just are like, oh, is it COVID? Like,
That's good to know.
mhm. So yeah, I know that like our pediatrician's office has started doing that. If you call for a sick visit, they'll have you home test. So just like fewer residents even thinking about like kids going to the pediatrician for a sick visit would be getting a test that would be reported.
And which we do have test kits at Tip Town Hall in the health department while supplies last. And some of the other departments, we've been putting them out too. So if you go to pay your any bills over in the clerks, we have some over there as well. Let's see. As for vaccinations, in mid-April, the FDA and the CDC approved a second dose of the bivalent vaccine for those who are 65 and over, and with a medical condition, which was very convenient because a few days later we had our clinic that we had scheduled at the senior center, and knowing that there was a new population of eligible people to vaccinate, we ended up having 56 people stop by, which was pretty good. So we're thinking about maybe doing one more just to kind of get that out of the way before the summer, so that people are vaccinated before they start traveling and getting on cruise ships and whatnot. So for now, we have 79% of town is fully vaccinated. And the numbers, the way the state's doing it is it's different now. We're not looking at all boosters. We're just looking at bivalent doses. So at 24% of town has had at least one bivalent dose. Let's see. So we did restock our test kits maybe like about a month and a half ago, so which we have a good amount. But as the end of both the national emergency, coronavirus national emergency, and the public health emergency have just occurred, May 11th being the end of the public health emergency, they're no longer free for us to get, which is unfortunate. But if, need be, I think they'll open up more towards us, and also we can use the state contracts to purchase any if we do find we need it. But we have a nice amount now, and they won't be back. They won't be expiring anytime soon.
Well, and I think they were saying, when I was reading on the DPH website, they'll reassess based off of if there's another like community spread wave, or, basically how they do it with the flu. And a lot of it will now be covered under your insurance coverage too. So like many people who don't have access can get them at the pharmacy under their insurance blanket as well, from what I understand. But that's, again, we're in this new whole wave of what is life now. So I'm sure we'll get more information, like you said.
We were just a little upset because the state had told us on their weekly call that they would be free to us for a while, or at least Department of Public Health had said that. And so when I went and I applied for, they have a survey that you fill out, they no longer were offering it to us. But they, pointed us to the link for $5 a kit. So we'll see how that goes, I guess, in the future. I guess with the end of the public health emergency and the national emergency, it's not the end of being able to have access to these services. It's just there's a little difference in the way that things are, go through our insurance and everything like that. But vaccines will still be free for the foreseeable future. We're still going to be trying to get them in the town for events. So, I encourage everybody, if you're not current, if you haven't had your bivalent, or if you're eligible for a second bivalent, go any pharmacy has them, and keep your eyes open for when the town does it again. And let's see. Okay. Other business. April was Public Health Month, and the first week of April was Public Health Week. And we were kindly asked to staff a booth and to talk with the health sciences student at Springfield College. And it was a really fun experience. And I think I met 2 students who were actually from East Longmeadow, who were interested in public health. So it would be nice to recruit them for, future public health positions, which would be so nice. Let's see. And I hope that we get to do it again next year. Let's see. So spring is also in full swing at the health department, keeping busy with pool inspections, code enforcement inspections, starting to review camps, and we're definitely getting a lot of temp events. So people are planning for all the fun outdoor activities for the summer. And that everything's been going pretty smoothly with our transition to the OpenGov software. And hopefully we'll be adding more permits to the list. And let's see. And the last thing I have on my list is that on May 12th, the state promulgated the revised minimum standards for fitness for human habitation, which is the housing code, which is our standards under the state sanitary code, which is MGL, chapter 111, section 127A. And with this happening, with the changes to the housing code, the community sanitation program at the state has conducted 5 virtual trainings, 6 in-person trainings, and these are with local public health, with housing court, with the landlords association so that everybody kind of understands what some of the changes are. They're not too heavy. They just make it a little more compatible with, say, building code, fire code, make it a little easier to understand and to work with. And all that's already updated on the state's website. And we are already going through and using them for inspections. And that's what I have on my list.
Thanks, Tammy. Any questions for Tammy or anything? Great. All right. Thank you for sharing all the hard work that you and the team are doing.
Very busy. I know that Alex has been looking at lots of properties. Everybody get out there. While people, don't like the way overgrown lawns and overgrown vegetation look, it's doubly important to make sure that you're, mowing and keeping everything back and emptying any standing containers of water, just to make sure we're going into tick season, we're going into mosquito season. And, these are things, they're easy fixes to kind of alleviate like the insect-borne disease burden that we have in the community, which is, it's been getting higher over the years. Last year we had a really dry summer, so we're kind of expecting there to be a boon in tick and mosquito-borne diseases coming forward. But we're still working. We're working with the Pioneer Valley Mosquito Control District. We had the new director that they have. He came by and we kind of talked about problem areas in towns with their catch basins and things like that. And I believe he's going to be going through and kind of looking at some other areas and just ideas for putting forth, for cleaning up those areas. If they have to have BTI for keeping the mosquito larvae down and things like that, which we do. I think we did it. We did our first May treatment at the ones that we've already identified, and then we'll do another one in August for the catch basins. Most of those are around like the parks and things like that to kind of keep it down for sports and activities for the kids. So hopefully, and I'd like to also keep working on trying to get the message out to the residents on staying safe, because it is part of it's been identified in our master plan for coming forward for 2023 for a health department activity to work on mosquito control in East Long Meadow. It'll be interesting.
So yeah, that was the last update on the business at hand, right? Was the master plan and how it applies to the vector-borne disease mitigation.
Oh, good. I'm glad you had it, and I got it. Exactly. And that is exactly how it is.
Okay. Anything else on that, Tammy?
Yeah.
Yeah, I know the little tiny bits of water too, right? Like the bottom of the watering can or the bucket you leave up and then it rains, or all those kinds of things important to address too.
Sandboxes, toys, garbage barrels, tires, definitely a big one. It's not only that it collects water, they're warm as well, so it helps promote breeding.
Do you still send off samples to the lab at UMass?
You can do them yourself.
Okay.
And you just have to reference that you're from East Long Meadow. But I don't think we don't get a lot of calls for them, it seems. But we have information. We have the little tick identification cards over in the health department. So if anybody is thinking that it would be a great idea to have them on them for when they go hiking, stop by. We have plenty of that information.
Great. Yeah, that was just going to be my question, is to reach out to the health department if you have any questions about any of that.
Yeah, it's not through UMass anymore. It's through Tick Report, and it's $10 to get your tick tested. So if you find a tick on you, you can put it in an envelope, mail it out, and they'll test it. And you would just like let them know ahead of time on tickreport.com.
And because that takes so long, I would highly recommend reaching out to your primary care physician or advanced practice provider about other guidelines around tick bites. Because is a secondary evaluation that we then go and determine if you need prophylactic antibiotics or if you need to actually have a full course of antibiotics, depending on your symptoms. Because the analysis of a tick can vary between a very short amount of time to actually a very long amount of time, depending on how many they are getting at, a period of time during the year. And I also would tell people that we're already seeing tick bites like way earlier because it was a very mild winter. So just be very careful to check yourself every time you're outside, not just hiking. I've had them in my yard recently.
Or just sitting in the park, watching, baseball practice. We've seen them.
Bug spray by the back door and in the car all the time. Right.
Absolutely.
Beach is my friend.
Mhm. All right. Is there any other business for tonight? Any upcoming events or anything, Tammy, we should be aware of, Alex?
A lot of fun activities, but not health department activities, ones we have to work at, but
Well, great. And I know as summer starts, it feels like summer here. So starts to get into busy season with, some of the things that go on in town. So thank you for all the work you do and the whole team.
I know the town's already planning for the fireworks for the July parade and the fireworks and everything like that. And it just sneaks up on me so fast.
Yeah.
Gosh.
Yeah, especially with the permitting and the new system and all that kind of
Mhm.
stuff. The temporary permits, I'm sure, are rocking and rolling.
There's been like a couple new businesses and what else has been? I just feel like it's a nonstop steady stream of just activity, which is nice.
Yeah.
Rebecca, Katie, anything else?
When do we want to meet next?
Great.
Promise we'll put the right date in whenever you pick.
I was like, I'm so confused.
We hurried up and we put it in the calendar. I guess we just put the wrong day. Do we want a June date so that we can do a follow-up with the tobacco and if there's anything that arises, or do we?
I have a bunch of work travel in June, so it makes it a little complicated. Like normal when we would meet, I'm away in Chicago. If we want to keep it on a Tuesday, I could do the 27th.
I am away
Okay.
that whole week. But I don't care what night.
I might be able, I actually could do, now that I think about it, the 20th.
Rebecca, what's on your?
What day does the 20th fall on?
It's a Tuesday.
Yeah, that would be fine. Mhm.
Okay.
Yeah, June 20th.
Yep.
6.
That works.
Whatever works. I'm free then. Tammy, does that work for you?
Yep, I will be put because there's a dental appointment at 3. So it's like you can't make any other appointments for that day. Oh.
Okay, so the next meeting will be June 20th, 6 p.m. Obviously something changes, give us a yell, great. Travel schedules change, anything. We can be flexible.
Because we don't have anything to vote on next month either, right? We just had to do the tobacco. Okay. And then we can see in June if we need to for vacations in July and August, accommodate for people's schedules and stuff like that. Okay, that sounds good.
Right.
Right.
Okay. If there's nothing else, do we have a motion to adjourn the meeting?
I motion to adjourn.
I second to adjourn.
So roll call vote, Christine Johnston, aye. Dr. Katie Jobbins.
Aye.
And Rebecca Torsha.
Aye.
All right, meeting adjourned.
Have a great rest of your month, everyone.
Yeah, you too,
Night.
ladies. Take care.
Good night, everyone.
Night.